Hi.
Hi.
Nice to start time.
Yeah,
How have you been?
I've
Weekday.
been good.
Yeah.
How are
Thanks
you?
for okay, thank you. Uh Thanks for agreeing, Sweta, to
Yeah.
talk today. I know weekdays are very busy, especially when you're working on PhD and stuff. Many kinds of work are like that only. But anyway, I had short notice. So extra thanks for that. All right.
Yeah, I'm
And
really honored to be here.
okay, yeah, likewise. All right, so I'll quickly introduce and then we'll start. Okay.
Yeah.
So, hi everybody who's going to watch now or later or just listen, read the captions, whichever. Okay, welcome. And we're very delighted that, as I said, Sweta accepted at short notice. Sweta is a PhD scholar, like, you know, on the way to becoming a PhD candidate. Okay. And pronouns are she, they, um, and multilingual, largely English, but also familiar with Telugu and I think some Hindi also, right, Shweta? You know Hindi too, right?
Yeah, but I can't really speak that well.
Yeah, don't worry. Okay. And also, Shweta is the founder of Aces of Hyderabad. Although Shweta will modestly say nothing much is happening, all the posts over there are great, very relevant to us Aces. And I am Ritash, uh, you know, one of the founders of Rang, which expands his research and action for nurturing gender and intersecting identities. We are a grassroots intersectional queer collective pan India. Yeah, and actually, we have a couple of the founders at the Nepal border also, and very diverse group. And so, very importantly, this, of course, we all know today, the 3rd of December, is globally observed as the International Day of Persons with Disabilities. And we, both as panromantic aces and also with invisible disabilities, or what Shweta prefers terming as non-apparent disabilities, have learned to, of course, live with them. That is sometimes inevitable or often inevitable. But we've also started writing and speaking about that, you know, uh, collectively or together, whatever you say. And it's been a nice collaboration and a bond that we formed over the last few months. Okay, so we are going to actually now converse about, of course, we know about disabilities and of different kinds, physical, intellectual, mental, whatever we call them. Yeah. People use all other kinds of terms, differently abled, people with special needs, and they'll say like specifically challenged, all that. Sometimes some of us might not like them or find them patronizing, but then, who are we to deny, right? So, on that note, but definitely, I want to also reiterate, yeah, that so important for us to recognize that certain disabilities, just because they aren't apparent or visible, know, uh, they are further invisibilized. And when we have been living with them, we feel it all the more. And, I will, during this conversation, sharing a little bit about my disability also, which at 51 it's just worsened for me, but I never realized, yeah, they are categorized, but not just for being categorized. Question is that, because of which we need, specific, what do you call, support, and which are almost absent. So on that note, Shweta, I would like to ask you,
Yeah.
you use non-apparent disability, which again is your rightful choice. But why do you call that? You know, um, no, I'm not just going into the exact meaning of the term, or even just stopping at semantics, but what does it, imply for you as a person? Can you share a little bit, and how does it, affect or your life? You're a very young person, plus also your age, right?
Yeah.
So, yeah, we would like, uh, want you to share.
Sure. Just like some people do not identify with the word disability, some people choose differently abled, and some people choose specially abled. It's the same way that I choose non-apparent disabilities instead of invisible disabilities. Also, because I have been researching on it, I've been reading how people identify with like invisible disabilities, right? In like those are all like not research but personal narratives. So I like the fact that they say some say that invisible disabilities kind of invisibilizes us just like the word. And already we are very erased from even disability narratives, we are erased. So using such a term, I don't think it represents me. I would choose non-apparent disabilities because apparent makes it less of a thing, less of visible invisible thing. Also, non-apparent comes with a lot more flexibility in the visibility space, as non-apparent means as soon as you look at someone, like in a quick conversation, you do not find it in a person, right? So that's why I choose non-apparent disability. It is little less invisibilizing in my understanding. It's just that how it represents me, and that's all. I mean, I completely agree with other words. There is even hidden disabilities, but people have problem with that as well, because hidden disabilities imply that we are trying to trying to hide it from people. So these words have different meanings, right? And people take it in different ways. That's the reason I use non-apparent disabilities, because it expresses me better.
Fantastic. So nice that you explained in such a lucid manner. It's also a reason why I thought we should have live conversation,
Yeah.
because not everybody can read, and it will take time for you to actually bring out your story, right?
Yeah.
Oh, and sort of this also is another medium for us to share. And yeah, and yeah, that's another thing which you said, hidden disability again. But as you say, also like, we respect people's choice of term, language, and mode of communication, or to literally not disclose, right?
Yeah.
Yeah, maybe as we are talking, I'm thinking of undisclosed disabilities, whatever, but it is
Yeah.
completely their not just a choice alone. It's, I think, they're right, and most importantly, all this comes from comfort, right?
Yes.
Yeah, and as long as people respect our use of terms, we both have lots of respect, and
Hmm.
like we've become, as I said, now just not mere co-authors, collaborators, we've become friends, right?
Yes.
What I feel about that, and which is fantastic. Because also, through our conversation, we have learned not only about each other, also, or of course, perspective experiences, but also in the way, like, of us can have heard or read everything and everybody. So, that way, kind of, sort of we are enriching each other is what I okay. And yeah, so, and also I remember, Shweta, you initially hesitated a few months ago, and I was like, when, and I'm glad that, you agreed and very grateful. I'm reiterating in every live reiterate that, we're so grateful. People, many of us, with multiple challenges, despite our privileges, yeah, negotiate life. And there is no need for us to put out narrative. And it's not even we're claiming, oh, we're going to inspire somebody, but I think more importantly, it is to inform. Yeah,
Yes,
that's
yes.
here. And yeah, so that brings me to, yeah, and this I think, one of the things that we agree on, whatever we use, non-apparent, hidden, now as I say, undisclosed, or whichever, uh, most importantly, these are getting uh, you know invisibilized, right?
Yes.
Rather, not even that they are getting invisibilized, they have already been invisibilized for so many years, decades, whatever. And I think that continues, right, Shweta?
Yes,
I
yes.
think that is what bothers us, and I'm sure, like so many other like people who are
Hmm.
living with these. I think we both shared with each other about certain listings or whichever, right? And in that, some of the disabilities that you and I have been living with, yeah, are not even there.
Yes, yes.
Yeah. So, yeah. So you were also, I think, earlier once saying that, just because it is in a list or not in a list doesn't change you know, our experience, right? Or our
Yes.
challenges. And I would like you to elaborate a little more on that. Why it's
Yeah.
important to have them listed, but what are the and what are the disadvantages of not being, so-called officially recognized?
Yeah, so the Indian law, the act which was passed in 2016, I think, yeah. So that has 21 categories of disabilities. So if you have a disability, you have to fit in those 21 categories. But there are two things that are missing. One thing is that there are several other disabilities which are not included in this 21 categories. Uh, Also, some like diabetes is a serious issue, and it is considered as an invisible disability in many countries, and when it comes to India, it's not considered. So there is that thing where so many conditions are not recognized as disabilities, so that lacks the legal framework for those disabilities. They can't even call themselves people with disabilities because they are not listed. And there are another set is that in these 21 categories itself, there are visible and invisible disabilities which can come under same name, right? And that becomes more uh, confusing, and people doubt whether we are telling the truth, because one person with the same condition can show the symptoms in a different way and the other person is not showing that way. And yeah, that's how the problem comes. And then it becomes a problem for getting the certificate, and a number on the certificate does not exactly tell the extent of the disability, and especially when there are multiple disabilities, it becomes very complex. And I think the whole law is kind of ableist. That's my opinion. But I do think that because law is made by able-bodied people, so when they are trying to give us rights, it's like something they are giving to us. It's not rightfully ours, and we are not claiming for it because they made a process that way. Also, same with reasonable accommodations, and we know how we talk about reasonable accommodations. Yeah. So you're on mute, I think.
No, 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 no. Sorry, I have this thing of moving my phone because also of my various, pains and aches. Okay,
Oh.
Okay, am I audible now, Shweta?
Yes, yes.
Okay, okay, yeah, thank you. All right. So, oh my gosh, you made so many vital points, which are yeah. We will come to reasonable accommodation a little later,
Yeah.
but it's good that you even mentioned that. But there's so many things. But I think one of the um, important but importantly terrible things that happens is able-bodied people you know
Mm-hmm.
making these laws, categorizations and all that. Okay,
Yeah.
that is one really terrible thing. The other thing is about certification or whichever, and that too having some numeric number attached to that. It is like somewhere. I would like you also to elaborate a little more.
Mm-hmm.
I'll just finish some comment on that. Somewhere I feel, first of all, as I said, I learned just like about my asexuality, I learned about these being categorized as invisible disabilities or invisibilized disabilities uh,
Mm-hmm.
much later in life, despite, having whatever access to information and stuff, right? And that is
Mm-hmm.
because, but that at no time, no way reduces my hardships which I have been experiencing, nor even is it's rather and these numbers no are more like a misrepresentation, you know
Yeah.
that also unfortunately by again able-bodied people, more so say physicians or whoever are qualified or to certify. But many times we all know, yeah, and this is where being able also, we find that either health or government apologized or the other is completely, erased or denied because somebody who's sitting there, even unfortunately so-called experienced healthcare, say, like for example, this or an ophthalmologist or for you specifically would psychiatrist is there, but and for many people, or if it's our asexuality, often all these people, they are not only not living our lives, okay, or had our experience. I'm not saying not uh, or who are themselves not uh, or abilities, but more so because many do not have any of this. Well, it's tragic that these people who have so passionate and uh, uh, and also new information, because otherwise, no, because any decision, whatever you will be discussed or learn time, right? People end up by those certificates, especially those numerical ones, somewhere they're not a reductionist, but somewhere of giving their judgment on our experience or challenge. I hope that is not too. Hello.
Hello. Yeah, I mean, your voice was breaking in the between, but whatever I understand, I will answer.
Sure.
Uh, so, yeah, you're right. That number is very reductionist, and someone decides the extent of it, and someone also from the medical background, right? And we have this medical model of disability which says, which looks at disability as only a medical condition, but it's way more than that if it's constructed by the society, the limitations imposed by society. So this certificate thing is medical model of disability. Although it's very outdated, it's still happening in practice. I think they should bring the social aspects of it as well into the legislation, and also, as you said, they have not experienced what we experience, not even a bit of it. So I would say they should include more people in that positions, or at least our lived experiences into the account when they're making such a law. That's very, very crucial. Uh, with every single law, like every even the reservations or everything, because people need different things. We have all have different conditions, and even if I have a same condition, our like symptoms are different.
Right.
uh, Maybe there's a personally I have visual impairment, with one of my eye almost blind and the other one has very high power. So me in a normal situation, when I'm looking at the screen for like 8 hours, I might tear up sometimes, or
Mm.
I might need my eye drops, or I might need to put away my screen for a little while. But when I'm actually doing official things like exams or something, I can't put my screen away, I can't look away, I can't even look the other side, because it's an examination, you're not supposed to look aside.
Mm.
All these things are uh, not even thought of as important. uh, and yeah, like I wrote this JRF net JRF exam. In that also, like because of my disability, they gave me 1 hour extra, but all that I needed is a bigger screen.
Mm.
And maybe I could, like, with a bigger screen I can see the whole question at once, and maybe the mouse pointer could be a little bigger. Those were my problems, not the time at all.
Ah, yes.
I mean, time was a problem because of those things. Because the screen is less, I have to keep moving the screen to look at the whole question. And that makes it like I take more time to read the question at that time.
Yeah. Yeah.
But then you're not reducing the limitations,
Mm.
you're not accommodating the way I want to be accommodated to be equal. Instead, you're just giving me some grace. That's what they say, no? Grace time, grace period.
Ah, right.
That's not what I want. I don't want pity. I don't want grace. I want what I rightfully want,
Mm.
to feel equal, to just write the exam, the same exam that everyone is writing.
Yeah, yeah, yeah. You've put it very beautifully, and without much ado, we will go into the reasonable accommodation thing.
Yeah.
You know what? As you're talking, and these very specific examples that you're giving, yeah, that
Hmm.
yes, the medical model of disability, like we were talking about, yeah, asexuality and other things, and anything about queerness for that matter, all the time, as I said, first of all, not only pathology, there's no need even to medicalize it, right? Yes,
Yeah.
it affects health in various ways. But what I think people, especially, the healthcare providers or the people who make those laws and curriculum and everything, uh, it's not that they can't understand, they refuse to to realize or to admit that
Hmm.
that whole exclusion, that whole reductionist approach is what causes the health issues more
Exactly.
than actually this being a disabling factor, or this being an abnormalizing
Yeah.
condition, right?
Yeah.
So that whole thing about normal versus abnormal itself affects us. And also this very important thing, no, that I mean, all of us from the various excluded groups use this, right? Nothing about us without us. And this
Yes.
is also very true for us with and much more for us with invisibilized disabilities, right? And
Yes.
this does not mean that people with the apparent or visible disabilities should carry that responsibility or burden. Not at all. But it
Hmm.
is the able bodied ones, the
Yeah.
ones who are talking about or terming it as grace, right? Terming it as reasonable, which actually is unreasonable, which is almost irrelevant, the kind of thing what they do for us. Like, just about giving us some handout leftover kind of thing, right? That is what, yeah. And here it is not just about terminology, it's a question of a mindset which makes them use these terms and thereby act accordingly, right?
Yeah.
I mean, so coming to, and then you were also, reiterating on limitations, right? That's
Hmm.
the whole thing. This whole thing of reasonable accommodation is what actually limits, from an ableist perspective, from an
Hmm.
ableist understanding or rather misunderstanding, what we need, right?
Yeah.
Yeah. So, would you like to add
Yes.
something on this?
Yes,
Mm.
just like you said about medical model and social model, in the same example that I've given before, the problem is not with my eyesight. I
Mm.
can see the screen, but the time frame that they give, the size of the screen they
Sorry.
give,
Mm.
it's what they give. They
Mm.
provide, right? The screen, the environment, and usually all these government exams happen in a very closed dark places. That's
Mm.
what are the social limitations that I'm facing. That's that cannot be explained through a certificate, that cannot be explained to a number, right?
Mm.
And it becomes very subjective and personal. And when you ask for reasonable accommodation also, it becomes problematic, because uh, how do I explain through the certificate that this is what I need? Because it's not about the certificate, it's not about my medical condition, it's about what you are giving me is not enough for me to be equal. And also, uh, when I say that law is ableist, I mean, when we talk about, like, when do disabled people come into the uh, law discussions? We only come when they are discussing the disability law, when they are discussing the fundamental rights, fundamental duties, all these other parts of the constitution. We don't come in.
Mm.
That's We never come in. The word disability does not come in.
Mm.
So, as a woman, I can say I have a right to education, I have a right to freedom, I have a right to speech, and all that. As a disabled woman, I don't think I can say that, because
Mm.
society is coming in between me and my rights
Mm.
as a disabled
Mm.
person.
Right.
Like, as a woman, I can say I have a right to education and I can go to school. But as a disabled person, me or anyone else, person with disability, maybe they need a wheelchair access to the school. That's stopping them from like taking their fundamental right. All these accessibilities are only talked about in disability act only, like few, maybe 100-page act that does not encompass all the rights that we have as a person. That's where the limitations come in as well.
Superbly articulated, Shweta. You talked, also highlighted in a very socialized way, also in a very realistic way, that each and everything that they literally, enforce on us people with disabilities, especially the invisibilized ones, is like starting with that card or certificate or whichever, plus that number, as you say, it is just giving you, it's like giving you another badge. No,
Yeah.
one more label. Ante. It does not at any time go beyond that. That number doesn't mean anything, right?
Yeah.
Fact, it is somewhere not only reductionist. If you ask me, or I feel that it is sort of miscommunicating, saying that, oh, this person, for example, has 70% disability, right? That means they, but what does 70% mean? How do you decide 70%?
Yeah.
You know? So, and again, it is taking the benchmark of a person without a disability
Hmm.
to rate you, rather than saying, rather than the other way around, right?
Yeah.
Because an able-bodied person is never compared, is never benchmarked against us, right?
Yeah.
I mean, against us in sense, in comparison with us, right? And worse still, these lists or whatever, wherever the classification is there, why that is also very unreasonable and limiting is because, first of all, we don't even know that such lists exist. Yeah, I will
Yeah.
quickly switch for a little bit to Telugu deliberately. Okay.
Sure.
Yeah, and akkada our list. I mean, this is for people who may be watching later, and I know a lot of people who know Telugu who wanted to join, they could not. So this is also for them. Hi to the Telugu speaking people. అక్కడ ఏంటంటే మేము చెప్తున్నాము ఇప్పుడు ఫస్ట్ వికలాంగులు అంటే అది అంగాల ప్రకారమే అంటే అవి కనిపించే అంగాలు సంబంధించినవైన ఆ ఇదేంటి సవాళ్ళు లేకపోతే అవి కానీ ఆ విషయంలో ఒక రేటింగ్ ఒక కార్డు ఒక సర్టిఫికేట్ చేస్తే వాళ్ళు చాలా వరకు ఆ ఇదేంటి అంగవికల వాళ్ళు కాదు లేకపోతే వాళ్ళు అర్థం చేసుకోవడానికి కూడా ప్రయత్నించరు. అఫ్ కోర్స్ ఏంటంటే వన్ డాక్టర్స్ విత్ డిసెబిలిటీస్ ఒక ఇట్స్ నాట్ జస్ట్ అ మూవ్మెంట్, ఐ థింక్ ఇట్స్ అ గ్రూప్ అండ్ వీ హ్యావ్ సమ్ very what do you say, admirable, inspiring people over there, and who are further pushing the envelope on the understanding, the inclusion which is supposed to come right from the training curriculum. బట్ శ్వేత ఏమంటున్నారంటే మళ్ళీ ఇప్పుడు అదొక హెల్త్ ఇష్యూ అవ్వచ్చు, కానీ అది హెల్త్ ఇష్యూనే ఒక డాక్టరే చూడాలి అనే ఇది కాకుండా సమాజంలో మనం అందరం సమాజంలో ఉన్నవాళ్ళు, సమాజం వేరే మనం వేరే కాదు. కానీ ఫస్ట్ మనల్ని ఇప్పుడు కనిపించిన అర్థం అవన ఇదేమిటి అంగవికలం ఉంటుంది, అవి అసలు ఏంటి సమాజం మొత్తం సమాజం వేరే మేము వేరే అనే లాగా మాకు ఒక ఫీలింగ్ తీసుకొస్తుంది. ఇంకొక విషయం ఏంటంటే దాంట్లో లిస్టులు, నంబర్లు, సర్టిఫికేషన్లు అయినప్పుడు దాంట్లో మళ్ళీ ఆ లిస్టులు తయారు చేసే వాళ్ళ సర్టిఫికేషన్లు ఆ పర్సంటేజ్ ఇచ్చే వాళ్ళు కూడా ఇది అర్థం చేసుకొని ఇవ్వరు. అది ఆ అంగవికలం ఉన్న వాళ్ళని వాళ్ళ దృష్టి ప్రకారంగా చేస్తారు. కానీ మాకు ఏమి సమస్యలు మాకేం అవసరం ఉన్నాయో అవి పట్టించుకోరు. అండ్ అదే అన్నమాట. Another point which this leads me into another thing, what you said, Sweta, about how this again coming back to our I say favorite because actually when even we started discussing a little more when we were co-authoring one of our articles or papers, Shweta and I somehow just got very not just outraged at this but in a very oblique way, partly amused, because again it takes that very charitable, very pitiable kind of perspective towards us. Yeah, that reasonable accommodation means okay, I will give you this much. It's like for instance, when Shweta went for that exam, fine, you give them extra time, okay, but in that time and did they consult Shweta or somebody like Shweta, right? Though each person's experience and need would be maybe different, even if they're largely similar, that whole thing about nothing about us without us is completely ignored, which is why we have to keep restating it. So just by giving a slightly larger screen and extra time, but it defeats the purpose by putting Shweta or anybody like her in a dark room kada. Ippudu I would like you to elaborate a little more about this situation. Because again, this is the same governmental agency, governmental body, or whatever, a part of the governmental network, yeah,
Yeah.
which unfortunately, again, it should be first. Government is also a part of society. It is just that they are playing a different role. But instead, they behave like, they are not only the dictators, the decision makers, but the deniers of something. Okay. Uh,
Yeah.
yeah. So I'd like you to respond to that.
Just a second.
Sure, sure. Yeah. You want to drink some water or take a breath, that's fine.
No, no, no. Yeah, yeah, like you said, we have to negotiate with them. Like, how much will you give me? To be equal.
Mm,
Also, the number also becomes a problem when
mm,
uh, they say that after 80%, I think it is critical disability.
mm,
So critical people with critical disability, they get some tax benefits and some small stuff like that, but even the tax benefit thing is problematic because for people with benchmark disability, which is 40% from 80%, they get like 75,000 tax benefit, like you can apply for exemption and all that,
mm.
because that is the estimated amount we spend on our hospitalization and all that. Okay, so based on that percentage,
Hello?
oh, I'm sorry, I think I was on mute.
Yeah, no problem. Based on the percentage? Yeah.
Based on a percentage, they decide the approximate amount that we are going to spend on our hospital bills and everything, because our identities are very medicalized, they expect like
Mm,
that. Uh, and this also becomes problematic because we have different needs, medical needs. Someone with chronic illness might have to go to the hospital so many times than a person with a wheelchair, maybe, because that's more of like medical continuous medical procedure. The chronic illness people have to go to the hospital multiple times. Like, based on a percentage, how do you decide how much money they are exempted and how much money are they
yeah,
supposed to
yeah.
use for the hospital? It's not just about money, also it's about uh, we all come from different identities, different class, different caste, different gender and all that, so all this does not come into the picture when we talk about disability
Mm,
act, because that is very important, because also the representation is very white, very male in the disability space. Also, there's very few representation, and that also is very male, very white, and very visible, because they said that it's a visual media, so it has to be visible,
mm, yeah.
right? Yeah, so am I going off topic?
No, 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 no. No. You're very much bringing out so nicely, so, flawlessly. You're bringing out so many aspects. Okay.
Yeah.
So, just, uh, you know,
Mhm.
so am I interrupting?
No,
Or
no, no.
no, again, you're so many points. And uh, boost that. Right. Because that's the other thing. Chronic illnesses are also very, very disabling. They
Hmm.
they are easy to hit for it. You have to tell me how many chronic illnesses, okay,
Yeah.
they are chronic for what the treatment is ineffective, but insufficient. Uh, not sufficiently, or maybe the body just cannot, you know, uh, digest that most of the time. Digestion started at 9. This world it means that I having crossed age 9, they won't take. been very shocked because seems like it's a small thing. How can you get it when but what it is? And at least, despite the 80s, I was still, class. I'm in urban, large metro line. Then it was Madras. We had some access to, reliable uh, health and competent practice. Plus also, despite all that, my parents, did whatever they could to ensure that I was held. Not that become my daily living and stuff, because I had what I always call an a holy hut, uh, so-called closed, but has its strong effect. And that actually is also like an invisibility, because, like, say, for instance, you use like I'm using mine thing, Sweta, much more acute. To wear glasses all our lives means that these are only sort of, uh, in a way, aid to help uh, uh, our work, or they are not would say completely, you know, ignore that our your are gone. Chronic illness is like, use that acute, yeah, that so-called in the environment, or even in,
Sorry, sorry to cut
sorry,
you off.
yeah.
I think your voice is breaking a bit.
Okay, okay, yeah. So, yeah, unknowingly, I keep moving my phone. Sorry. Thanks for yeah. So,
No
all
problem.
I was saying was, eventually something is a chronic illness, or
Mm-hmm.
something broadly comes as is categorized as a disability, because not only it is there lifelong, any kind of support or intervention or treatment can only do so much. Okay,
Mm.
right? So, and that circles back to our reasonable accommodation. So, reasonable accommodation is unreasonable because it's not only insufficient and largely determined by somebody who's not had this experience,
Yes.
but refuses to, to stay away or shut up and include us.
Mm.
But also that sometimes the so-called reasonable accommodation is actually, in its own way, debilitating, because, like in your example, still that mouse and screen were unsuitable, and because they were giving you a separate room or a space, they did not even ensure proper lighting, right?
Yeah, I mean, I was not given a special room or anything. I
Oh,
was
oh,
sitting with everyone.
yeah. Okay.
But that whole room with so many people is very dark.
Yeah, yeah. So actually, then, that is what, that it was not only debilitating, it was furthering your disability in that at that point in time, right? That,
Yeah.
but actually, they should have given you a better space,
Mm.
because a better physical space, right?
Yeah.
Yeah. So, coming a little more to your personal experiences,
Okay.
okay. I mean, I know it might sound cliched, or maybe, yeah, but anyway, um, is it fair to ask you to share a little more about how from childhood
Mm.
you have been,
Mm.
literally, it's like, to navigate, we actually have to negotiate, na?
Yes.
Like, and also coupled with your asexuality, but yeah, I don't want to rush you into it, but as you want to speak and share. Yeah.
Yes, sure. So, my whole disabled identity, or anyone's disabled identity, is coupled with all their experiences from childhood and whatever they've heard, they've experienced, right? That's why I think it's a very good thing to talk about. childhood experiences and how it all began. I was born with the condition, but for me to realize that it's a disability and the extent of my vision low, like vision impairment and all that, it took me almost 20 years. Sadly, actually, I realized that I'm asexual way before than I realized my physical disability. Uh, yeah, so it's pretty complicated and
Hello? Yeah. Yeah, it's pretty complicated, and I think for a second I lost you. Yeah.
yeah, I got a call. I think I just got it. So,
No problem.
uh,
Yeah.
it is complicated when we are dealing with such invisible identities. Uh, and although it's a physical disability, which I can like really feel and experience each and every day, but to realize it, the extent of it and the everything, it took me 20 years and couple of I think 1.5 year of therapy also to call myself disabled, to like put in a form that yes, I'm disabled, you know. uh, it is complicated because my idea of myself and my disability, the extent of it and everything, starts with from our parents, right? Like how they view it is how
Mm.
you start to view it as a kid. So I kind of was told to hide it because I was noticed to be viewing the television from a different angle, because that way I could see it more clear, because my vision impairment is not just a number, right? Not just a sight. It's also that my eyeball keeps moving by itself.
Mm.
It's very involuntary and I can't focus on something in the
Mm.
so it goes cross again, and that that makes it a bit apparent when people are there around. They can see that, oh, why is this girl looking at the screen in a weird angle, right? So that was changed for me. Like my parents constantly reminded me, don't look at it that way, you have to get used to looking at it straight. But my experience of looking at TV is not considered. Like I want to watch the show and enjoy it, but that's not what is important. What is important is what other people might think, that I have something wrong with my eyes, right?
Mm.
These are the kind of instances that I've grown up with, and that made me not talk about my sight much. That made me not talk about many things that I've experienced. I think I also told you that sometimes I always sit in the first bench. Even from the first bench, I can't see the board in the school. And when I try to tell that, people used to say that, you're lying, we can see, you can't see, that's bullshit, you're wearing specs and I'm wearing specs, so there is not much difference and all that. So
Mm.
wearing specs became very normal, that the what do I say, spectrum in which we wear specs, the number and all that is not very considered, that they think it's just the same. And yeah, many of those experiences kind of shaped my understanding of it. I think when I was 18, it was the first time. Uh, it was the first time I went to the doctor by myself, and that's when I tried to started learning. And then that was like a shocking truth, that, oh, I have these many problems in my eye, and I was not exaggerating for all this while. People just call me liar just like that. It's also because of the limited understanding I have about myself. So I think it's very important for kids with disabilities to get the right understanding of their disabilities and right counseling. And it's not like counseling to make them equal or something like that, to just not feel that their disabilities are shameful or they're to be hidden, you know. I think those things will make it more apparent. If I would say disability, it can make the disability more visible, and like more visible in the sense that we try to talk more about it, and it will have a presence in the discussions. It will become more normalized. And also that it was a struggle for me to realize my normal is different from the society's normal.
Right.
That's, I think, a common experience about with all the people with disabilities, because we're like when we are born with it, we tend to do certain things in certain ways, but it might look odd to others, but we don't realize it. For
Mm.
example, if I'm searching for my specs somewhere, I usually put my hand first and try to find it through my hand instead of looking at the space and finding the specs. I
Mm.
uh, is that like, does that make sense?
Oh, totally. I mean,
Yeah.
such brilliant
So
examples.
yeah,
Yeah, please continue.
I
Please
was
continue.
told multiple accounts that maybe you should just observe and see the space and find it. You can find it by looking at it, right? I know it will take time for you to look at it,
Mm.
but maybe in 5 minutes you'll find the specs on the table. But
Mm.
that is time taking, right? For me to be efficient, I first keep my hand there and touch
Mm.
everything, and then I find my specs very fast. It's not
Mm.
just about specs,
Superb.
it's about books,
Yeah,
everything.
yeah.
So, and that was my normal, it's my normal, like, instinct.
Mm.
And similarly, a lot of things, we also talked about falling down on the street, right? It is
Right,
so
right.
normal that we're always thinking about it. I am always thinking about it
Mm.
when I'm going out by myself, right? Using public transport. It is also normal for everyone, but for me, it's not normal. It's like, maybe this step I will fall down. Maybe
Mm.
the puddle that I might not see, I'll fall down. So I have to be ultra careful.
Right.
And especially it comes more when you're a woman with disabilities. You have to think about your disability. You have to think about your safety. Multiple things go in your
Yeah,
head that you
yeah,
can't be in the present situation, like moment at all.
yeah, yeah.
And I think that is also a cause for my anxiety sometimes. When
Mm.
I'm going out, I can't enjoy it, enjoy the journey. I constantly think about what might go wrong. Maybe I'll fall down, maybe
Mm.
I will miss the station because I'm not seeing the board. Something like that, always keeps going on at the back of my head. Yeah, that's so exhausting.
Right, right, right. Very touched in the way, and I can completely relate to this. I know you and I have talked about this immensely. I mean, uh, I don't know. Sometimes in these factors, awareness, you being aware, us being aware of our own bodies, our own challenges. But when the world outside, either wants us to hide it or downplay it, or, sort of, uh, they actually, this is all unreasonable accommodation, because
Yeah.
not only that they are disfavoring us, they are even forcing us to not be comfortable with ourselves. Maybe we will adapt faster and better. Just like, it's such an important example you have given. Automatically, that our hands or our leg or whichever, because somewhere subconsciously and maybe even consciously, you have trained yourself to function in a particular way. You have learned this is not accommodating alone, you're even adapting or readapting yourself,
Mm.
right? When, it's like wiring yourself, and you know whereas somebody telling you that is not the way to do it,
Ah.
without showing you the alternative, is I- just almost driving you crazy.
Yeah.
Okay, like, another thing, couple things that I was remembering, yeah, because over time my orthopedic disability have thing has become such an issue that to that I know sort of I had to become left-handed at least partially. Okay, and the first thing people say, and more so especially in South Asian context, and if you're an APAC, oh, you're left-handed, मतलब ठीक नहीं है, there's some nonsense like that. All these social things come up, all right, or like, yeah, I mean, so what, yeah, but explain that, I tell it became left-handed, like, oh, so sad, kind of. Oh, but you're handling it well. Well, yes, I know how difficult it was to get here, like adapt myself to become partly left-handed, and other sometimes, despite your best effort, because I've seen a friend possibly converted to becoming a right hand, but obviously whole body is not wired that way, right? And I've seen now, because I purposefully sometimes use only my left hand, despite my best efforts, there is confusion. Okay, and
Yeah.
the thing about, especially, my spondylitis, as I say, is never fully cured. Okay, yeah, but sometimes the triggers are there, and suddenly it pains. And then unless I drop something, which again not only irritate me, unnerve me, thing, I would not even but still use my left hand. There's at least some comfort in it, right? Versus the pain, sort of feeling that pain, right?
Yeah.
Yeah, this seems to be, people will be like, you're or a big fuss, or we are our best to adapt situations, to environments, and to people who are not accommodating. So when we're doing, at least let us do things our way. No, it's the same thing, like almost like as ACEs. We also find now this whole damn abnormalization and medicalization. But we have learned to live our way because we understand these things, or we might have learned the terminology late, or kind of taken time to come to terms with it, or come later. But still, we know, I mean, just even like everybody has some, there's nothing like perfect and all that, right? So, nobody can be the same, and the whole very reductionist way. Be careful, as you say. Be careful is so extra programmed into us. Okay.
Yeah.
But it's like, for, like you say, for you, I have to be. I'm on the edge all the time, or you are. We are on the edge all the time, because our whole thing is not to fall. Okay.
Yeah.
When we have additional disabilities and chronic, for me the whole thing is, okay, I'm enjoying this, but what if, on the way back I fall, or this again triggers or worsens my stomach thing. I mean, I'm like, and which is, and when you say, no, I don't want to come, or I want to be, they'll be like, you're fussing and stuff, but not. So yeah, and
Yeah.
mm,
Uh, just like you said, be careful, no?
mm,
That thing.
mm.
Similarly, I've heard so many things like, you should eat carrots that will make your eyes vision
Appa.
get better. I'm like, if it's that easy, why wouldn't doctors fix my vision, right?
అవును. Right. అవును.
I understand that eating carrots and all that does not deteriorate my vision further, but as if it will cure in a second,
Mm.
it's so casually coming at me. All these things are so funny sometimes. Like,
అవునవును. Correct.
yeah.
Yeah.
Also, one thing I understood by this conversation is that the society, it through the acts and all, it tries to integrate us into the
Mm.
society, right? When it's trying to do that, first of all, that is ableist because they're not letting us be ourselves.
అవును.
It's also they want to integrate us to act just like them. Like we should not be inch different also from them. It's like same thing with your left using left hand, right? They want everyone to be like them only then you will are called normal.
అవును. Yeah.
Yeah, me also. Like, it's not about me finding something just like a normal person or just like a non-disabled person. Uh, అంటే వాళ్ళు తీసుకున్నంత టైంలో I should find,
అవును.
right? That is not the point. I should find it just like them. How are they finding it? By looking at it. I should also do the same to fit
అవును.
it. So
Correct.
the way they want to integrate us is to change us into them.
Yeah.
I
Yeah.
I mean,
Yeah.
the whole presence, appearance, the behavior, everything should be normal according to them. Like
Yeah.
in
Yeah.
quotes, normal in quotes.
కరెక్ట్ అవును. అవును. బట్ వాళ్ళు ఏం అర్థం చేసుకోరంటే, వాళ్ళ నార్మల్, మనం నార్మల్ వేరే.
Exactly.
కరెక్టా? బట్ మనం వెళ్ళి వాళ్ళని అబ్నార్మలైజ్ చేయండి, యాక్చువల్లీ అసలు మనల్ని అర్థం చేసుకోండి అని కూడా అనట్లేదు కదా. మమ్మల్ని వదిలేయండి, మేము మా బతుకుతాము, మేమే ఏదో మేము ఎలాగో మీతో అడ్జస్ట్ అవుతున్నాం కదా అని వదిలే, అది కూడా వదలరు. యూనో
Yeah.
యా. బట్
Yeah.
actually that so-called concern and care, no, which is unnecessary,
Yeah.
it becomes అదొక ఇంటర్ఫియరెన్స్ లాగా ఉంటుంది, అదొక హెల్ప్ఫుల్
Yeah.
ఇంటర్ఫియరెన్స్ లాగానే ఉండదు కదా.
Mm.
యా యా.
I mean, we have like seats assigned for people with disabilities, but we with invisible disabilities can't take that
అవునవును.
seat. And because as soon as you take that seat, everyone will be like, "You're not supposed to sit here." Then I'm like, I have a certificate, I have a disability, this much, that much, but that is with your eyes. Why are you sitting? Even
ట్రూ.
if it's not that, they will be like, I can't see it, so I can't believe you. Maybe you forged the certificate.
అయ్యో.
Yeah, all these things are normal, right? I mean, I'm not saying this happened to me, but I've heard a lot of these kind of things. Like I follow this person who is in US, in who is a gay person with uh, visual disability. So all he can see is a tunnel vision and a little bit of light and all that. So he can look at people directly into their eyes when he's talking, right? And he has a service dog. So in his videos, he explained that when he goes to a cafe or something with his service dog, they stop him and they say that you're not allowed in here. That pet is not allowed in here. And he says that this is a service dog. Service dogs are allowed everywhere. But they are like, you don't have a problem, so you don't need a service dog. When clearly a person is trying to be equal and be normal and trying to fit in the society, so-called society, these kind of things come in between when people care about their belief more than actual condition and the experience of the other person. And these kind of things are happening in US, and when you come to India where there is very less there's no not even awareness with the professionals, medical professionals, and the politicians and all that, how will a common person understand my disability, right? Also, this case happened a few months ago where a person got like IPS officer who got the job using a fake certificate. That certificate is multiple disability
అవును.
certificate. Yeah. So, like responding to that, another IPS officer from Hyderabad, I think IAS officer, I think from Hyderabad, she said, how are disabled people even getting jobs? They're not supposed to be in these jobs. Like
రైట్.
she says that I don't trust a medical professional who has disability. How can you trust these people to do their jobs? I'm like, when there are IAS officers, the government representatives, and IAS is like very like knowledgeable, supposed to be very knowledgeable and open person, educated person, and who goes through such a rigorous process to become an IAS officer. They themselves have these views, and they don't think it's a wrong thing to say in public. I mean, it's not just that they have these things in their mind, they're saying it out in the public when such a huge thing is happening against the whole disability community. Where do we even stand?
కరెక్ట్.
You know, yeah. Like, where do we even stand and say that we exist, we with invisible disabilities, non-apparent disabilities, we exist just because one person took an advantage of a certificate does not disqualify all our claim.
అవునవును. కరెక్ట్. యా. అండ్ అంటే అసలు వన్ థింగ్, పీపుల్ దట్ ఎకనామికలీ మార్జినలైజ్డ్ అండ్ డిసేబుల్డ్ వాళ్ళకి అసలు యునో ఆల్ సబ్జెక్ట్ దిస్ ఇట్స్ వెరీ ట్రెడిషనల్. షాప్ పెట్టుకోండి, మొబైల్ ఫోన్స్ టెలిఫోన్ బూతే వాడటం. ఓకే. అండ్ ఇండి ఓకే, పోట్లాట్ become 3,000. That's another state. It is supposed at a unit, but the is you know so ridiculous, like state for subject, and they are not subjects of the state or objects of the, and all that that and you know it's not just for internally. That is the first step. deformity, handicap, all that. Just a tip of, and um, actually, uh, you know, so, flow, when we, even if we approach and I trying to claim any pension or anything, right? We are not. We will pay for any supporting aids we get.
Yeah.
But all we are using, right? And because of the social listing, they've been uh, like use temporarily some support like a word called touch. I was like, first of all, uh, but you know what? For me, not about the way it is viewed is AIDS, but also again the I know I am only 5 feet one, or 5 feet. All right,
Yeah.
or what would be made of some yeah. First of all, it has to be made of a light material. Okay. Uh, uh, what you use, eight. Okay. Uh, then there, first of all, whether I'm going to use long term or short term, going to with injury and the pain associated and maybe going to suddenly adapt this, which also extra and all that. I remember, when, but what I think finally I told that person it is destabilized me. And because you have the height advantage, you see that how they are, okay, and at least without like rather than it. So I am not going to be able to adapt to it. So so I would rather limp and then uh, um, whatever stumble because the kind of things that never worked very quickly. Uh, yeah, but
Yeah.
so these kind of things, essentially the way they are designed, not the environment around us, but these also they can be a detriment rather than support. So, so that's another thing which I found because
Yeah.
yeah, something. Yeah.
No, no, no. Your voice is kind of breaking.
Again, yeah, I'm really sorry. Today, no, as such, I think the network is slightly unstable. Plus, I am moving this, because again, I think the it is because also the mind has adapted to certain left, but not fully, right? So,
Yeah.
this is the right one. I'm trying to use it.
Yeah, yeah. Also, the weather, right? It's raining very bad. Yeah.
So I know it increases the orbit. No, not only yeah. So essentially, what I was saying was all the other kind of so-called supportive physical aids or the so-called the certification and all, they are not only indignifying or dehumanizing us, they are actually like an additional burden. If,
Yeah.
if a calipers is heavy or you know gla- uncomfortable, eyeglasses or whatever, they are not helpful. No,
Uh,
no, no.
hello?
What I'm saying was your walking support or whichever, for example, if you're using that, I said if they are not made of the required material and they are not light enough, they are not very huge. So that is, and I'm talking as loud as possible now.
Yeah, yeah.
Oh, that's what now. See the challenges of the physical environment being unaccommodative of our basic needs,
Mm.
so-called support aid, no? they are also, they're using it long term,
Mm-hmm.
not useful. And also, if you are, for example, when I had that ligament, I was advised to use that, the not what they say, na, for lack of a walking, walking stick, it was much more than called a crutch, right?
Okay.
So, 3 months, and I said, no, it was big and everything, not getting my size. At all, I could wear. Thing is that people were using it, but because the injury is internal, they'll be like, hey,
Mm-hmm.
yeah. So, like, why are you for you, suppose you use a seed, no,
Yeah, yeah.
and suppose I for many in this weather, I'm wearing my knee bandage or whichever. Because for pajamas, no, and I may because of that.
Yeah, yeah.
Use a seed, okay. And people like, why do you want to take that? If at all I use the disability, like, you're okay, no one.
What?
There's some background noise, Sweta. I think that's why you can't hear me. Hello?
What about now?
Yeah, now it's okay.
Yeah.
So, what I'm saying is
Mm-hmm.
that our pain or whatever is
Mm-hmm.
internal, and like in this season, I tend to wear a kneecap.
Yeah.
Okay, but it may not make me limp. Okay, feel the pain
Ye-
inside. Okay,
Yes.
and which is why supposing I use in a public transport that seat for people with disabilities,
Mhm.
people can easily question me, no,
Yes.
why, whereas I know it, and because I'm wearing pants, the that won't even be seen, that kneecap or whichever, right?
Mm.
Oh, I mean, not everybody tries to misuse the system, no,
Mm-hmm.
or a bit, right? So, so why should we have to always, and as you say, uh, you can't and you needn't to be carrying your disability certificate or, be visibly this thing to be able to prove to somebody, right?
Mm-hmm.
Yeah, so that's all.
Yeah.
Yeah.
That's also the sad part. I mean, we always need a piece of paper saying
Mm,
this is the problem I'm having. Also,
right.
I think the visibility, invisibility aspect also comes from the ableist idea of people thinking that disabled people should look helpless
Ah.
and they should be asking for help. And,
Mm,
that's the idea. It also stems from that if it's not seen like you're helpless,
mm,
uh, you're not disabled. You're not having such a big problem.
correct.
You just look like all of us. You're doing normal things, right? So it is not a big deal.
Mm,
You're just making a big deal. That's what it's.
yeah, yeah.
Mm.
And you're managing very well, na.
Yeah.
But the thing is, if you're managing, we are not able to do things,
Mm.
yeah, that is a thing, no. It's also especially even it the way the whole social system, the educational everything,
Uh-huh.
somebody who is so-called, you know because this whole thing programmed to see an ableist behavior, you know
Mm.
intellectually, oh, this person is smart, sharp,
Mm-hmm.
is so slow, you know
Yeah.
realizing or addressing. And the younger that these comments are passed on you, and
Mm.
it's like a trauma, it's like a shame, it's a pressure.
Yeah. Internalized ableism, right?
So you're always trying to prove, or as you say, adapt yourself to the
Yes.
able world, rather than, it's like even as asexual people kada, we,
Mhm.
oh, మాకు అది లేదు అని అక్కర్లేదు అని. బట్ ఎవ్రీ టైమ్ యూ టు జస్టిఫై, ఓ అది మా వరకు అక్కర్లేదు, బట్ అది like I made some small videos in, every time I was almost like explaining, like I know, नहीं ये सेक्स करना गलत नहीं है, और या मेरा एसेक्सुअलिटी वो क्या एक बीमारी नहीं है, I'm not taking a moralistic or any of that, or a prude celibate thing, right? So each time along with all this we have to justify, right? Yeah, rather than uh, uh, that way. Or the other thing about sympathy, oh, this person can't do, so let me help karke, they will not even let you do things.
They don't even wait for you to ask for it, right? They just come like, I'm the hero. Let me come help you.
True. Yeah. And that also is very indignifying, because
Yeah.
still remember my late Amama, when she had osteoarthritis. That's why we always feel that somewhere, I think, maternal family, that there's a tendency for orthopedic issues, and with generation is manifesting earlier. So when I used to say, అదేంటి నీ చేయి పెట్టుకొని మెట్లు దిగాలి అంటే, షిస్సే నో నో నో, ఐ విల్ హోల్డ్ ద రైలింగ్ ఆర్ వాట్ ఎవర్, అది లేనప్పుడే నాకు చెయ్యి ఇవ్వు. అండ్ ఫస్ట్ ఆఫ్ ఆల్ థింక్ లైక్ sometimes, oh, maybe she feels that I'm a younger person, so if it has something to do with her body weight. But then when I've grown also, why she's saying that? And I should tell her, no, don't feel that you're heavier, whatever. Then she told me, God, not to do with me trusting you or not, but it is more convenient for me to do, and when I need help, I will ask for it.
Yes.
Yeah? But that was because although she realized that not only I was meaning well for her, and I was not denying, see, of course she also realized I have my own challenges, but she also had the patience to explain, and make me understand very young in life that it is better you let a person figure out and seek the help that they need, because sometimes if I I can't feel her pain, right? Or
Yes.
convenient for her, right? You're only empathetic. So it was like I might have been counterproductive. It might worsen, because especially when you have joint pains and all that, as they call it, any small jerk can sort of inflate the pain so much, right? That so to be very careful. But yeah, so that, how putting it to me in simple terms, um, and me respecting that, I think at a very young age. So, and me also realizing that I have my own thing to, yeah.
Yes.
That
Yes.
you first take care of yourself, then go to help. And that is not selfish, but that is actually sensible, right?
Yeah. You're just sustaining yourself, not being selfish.
Yeah, right. So I, like think, but not everybody has that either the ability to communicate in a very realistic, in a very way, or also sort of try to understand whichever. But yeah, so somebody who is asked not to help should not feel, oh, that person doesn't trust you, or you're unnecessary, the person doesn't like you or something, but rather be respectful and say, okay, this person at least is telling you upfront. Yeah,
Yeah.
because whole thing, I mean, the same thing with chronic illnesses, especially when you have, say, just like you have, we can have of all kinds, and nowadays and food allergies also, especially again in a South Asian context or an Indian context. When you say I have a food allergy, I mean allergy or whichever, uh, that is going to upset you, you're again considered fussy, or it's like, oh, ఇదేంటి మా ఇంట్లో అంతేమి కారాలు something, for example, okay, or we cook it safely only, kind of thing, right?
Yeah.
But if you're going to go up and go home and say throw up or have semi diarrhea or something, what even is the point, right?
Mm.
Oh yeah. Oh, the వాళ్ళ మర్యాద కోసం మనం తాగాలి. We shouldn't ref.
Yeah, yeah,
Yeah.
yeah. Oh, yeah. Like, I just want to conclude it by saying,
Mm,
our identity is depending on how others perceive us,
mm,
sadly, in this society.
mm,
And when, like, the politics of visibility and invisibility are very, very present in the disabled, discourse, and we need to talk about it more and more. And I just remembered this poem
mm,
by Hanning. He's
mm,
a black man.
mm.
Uh, it's called The Magic Wand.
Okay.
So he talks about, as soon as when he opens his wand in the sense, he means by saying this thing. What is it called? The white cane that
Mm.
he
Oh
uses.
no.
So
Yeah.
he doesn't need it all the time. So he uses sometimes
Mm.
only. So as soon as he opens it, his identity changes from the black man who is dangerous
Mm.
to a blind man who is sympathetic.
Oh, who
So
needs sympathy?
yeah, yeah,
Uh,
like who is supposed to be sympathized with, kind of
okay.
like dangerous. Also, like black men are considered dangerous and all
Right,
that. So
right. Yeah.
just in one flick of a second, his identity changes just by opening the wand. That's
Mm,
why he calls it a magic wand.
mm,
And in the end, he says that it's like magic, and you are making the magic happen, but it's affecting me. Right?
mm. Right,
It's a beautiful poem actually. It's called The Magic Wand. I think everyone should check it out. But yeah, like it's very political. It like how our identity is perceived by others, and that shapes our whole experience.
right. Right. Essentially, no. Also, the way మన asexuality ni we have to explore it from an allosexual viewpoint rather
Yeah.
than our, and in that thing, as we always say, oh, either we are not being serious or we are. It's always coming from not this, not that. Kada. If
Yes.
we say it is this, that also they don't want to understand. But
Mm.
anyway, this is a lovely way to, end this conversation. But these conversations will continue again. Thanks so much to Sweta.
Thank you so
And,
much.
Satrangi Salaam to you and to everybody who has joined. Asalu, we are very, very happy that on a weekday, Shweta agreed and you all have joined. And of course, later also, if you watch, please comment, share. You might even listen, you may read, automatically captions are generated. So, yeah, and hopefully, Rang and the other collaborating groups, we want to bring in sign language interpretation. But again, it gets slightly tricky, ante ye bhasha vaadam and all that. So,
Mm.
anyway, but yeah, greetings and remembrances, you know, especially this whole month, there are many days dedicated to many people of various marginalities.
Mm.
Okay. And yeah, so thank you once again and all the best to you, Shweta. We
Yeah,
will,
thank you so much.
yeah. And we will continue, of course, our online, offline conversations later. All
Definitely.
right. Yeah. Bye, everybody. Take care.
Bye.
Bye. So I will tag you. I will save this and tag you, Shweta.
Sure.
Okay. Bye.